So we've been tracking the sudden spike of excess deaths this year around the world. We've been covering this story for a long time now. Why are country after country experiencing sudden, unexpected deaths? Question. I'll throw it out to you. You let me know your thoughts on this. Well, now we can add Germany to this list. Germany.
Should we define excess deaths?
Okay,
because we're not talking about deaths that are happening related to any given thing. The government sort of tracks normal death rates, birth and death rates around normal events, such as normally you get babies born in September because people conceive those babies around the holidays, that kind of thing. You get more drunk driving accidents around certain times of the month, for instance. And so the algorithm will give you a national average. And in most countries, we are seeing that average spike in recent months. Yeah, recent months. So it's all across the board right now. So now we can add Germany to this list. Germany, excess deaths up 19%, according to the most recent data. Vice President, parliamentary vice president, calling for an investigation now into deaths and damages after the pathologists who examined these bodies at autopsy all said, hey, 30% of them all had one thing in common. He's saying that. He's a doctor. He's a pathologist in Germany. They're calling for a parliamentary investigation. Watch this German news report.
Gründen der deutlichen Übersterblichkeit und auch Bundestagsvize Wolfgang Kubicki will es jetzt wissen. Im Interview mit der Welt fordert er jetzt eine Obduktion und Überprüfung von Todesfällen nach der Corona-Impfung. Kubicki bezieht sich dabei auf eine Studie von Heidelberger Pathologen Peter Schirmacher, der herausgefunden hatte, dass bei 30% aller von ihm untersuchten Fälle die Impfung die Todesursache gewesen sei.
So that's what the pathologist is saying. He's a doctor.
And he's saying this based on observation and asking for examinations.
He's seeing this in the autopsies.
And asking for investigations.
Yeah. So we're seeing this across the board now. We should probably maybe look into this and have an actual investigation. Be allowed to freaking talk about it. Censorship, baby. Not allowed to talk about it. Do a Google search. Go to Yahoo News. Try to do searches. You can't find it. It's suppressed. That's why. German badass Christine Anderson wants answers for her country and Europe and the world. She's a member of European Parliament from Germany. She asks this question.
When these vaccines became available, we were promised it would prevent contraction and transmission of COVID-19. All governments around the world, EU Commission, everyone, basically repeated that, began harassing and intimidating people so they would take that promised game changer. Well, turns out it was fake news, wasn't it? Somebody lied, and I want to know who lied.
Well, why are we just hearing about this? Why are we just hearing about this?
Can I say really quick that I just want to give kudos to Twitter, because I'm seeing this information now on Twitter, and they have like released all the guidelines on COVID. So it's like now I'm getting information that I had to go elsewhere to try to find on Twitter. So kudos to that, at least the conversation is happening there.
And things are being allowed to trend, which weren't allowed before. Hashtags around questioning the vaccination program. So yes, it's very interesting to see certain trends that were obviously suppressed before. Yeah, and certain trends that were being amplified, like we learned this afternoon. War in Ukraine war was being amplified because of the pro-Ukrainian Twitter army working at Twitter. So certain things were being amplified, and yes, we know what certain things were being suppressed. So why are we just hearing about this? Well, it's been suppressed, specifically on YouTube. Watch Dr. John Campbell get all tongue-tied, not being able to talk about this. And he shows us over the past few days YouTube's guidelines, and I love that he wrote them in Comic Sans font. Watch this.
So serious under reporting. Now, Google YouTube guidelines, just so you know, a reminder of what's going on here. Now, these haven't changed. And the YouTube guideline here, written in Comic Sans script, claims that an approved COVID-19 vaccine will cause death, infertility, miscarriage, autism, or contraction of another infectious disease. I'm not allowed to say any of those. So I'm going to stop reporting on that particular paper at this point. Because I have to follow YouTube guidelines.
So isn't that amazing? Like, what I love is that he does that. He puts up Comic Sans, to make a point. It's like, I'm not going to talk about it, but you know what's going on.
So now is a peer-reviewed paper, and I have to stop talking about academics.
Here's a peer-reviewed scientific paper that he's reporting on, and I can't talk about it because their guidelines won't let us talk about it.
And he's not just a YouTuber. This guy is a guy that has the credentials to be able to talk about it.
He is a medical professional.
Yes.
Right.
And so I would love to know, like, who on YouTube's staff is a medical professional? Like, do you have like a team of doctors?
No, YouTube has always just sort of deferred to the CDC. Whatever the CDC says, you can't violate, you can't speak against.
Or the WHO. Yeah. So you can't go in.
Oh, so that means we should be able to talk about the thing on that Died Suddenly documentary then now, right?
I don't know.
No, because they haven't updated. So yes, even though the CDC and the WHO have now pointed out things on their websites, YouTube's still not caught up. So you just got to get, it's like a slow, they're like really slow on this, unfortunately.
It's like waiting for iOS 16. It's like they're still in beta or whatever.
Yeah.
Waiting for the actual release.
So Germany is not alone in these huge spikes in excess deaths. Why are we just hearing about this? I'll ask that question again. Well, according to news reports from U.S. doctors, we're also learning that Dr. Fauci told coroners in the United States not to carry out autopsies. This is Dr. Ryan Cole, who admitted that Fauci was telling doctors, sorry, not necessary, don't do autopsies. Watch.
So what's happened to the autopsy, Ryan?
Well, Anthony Fauci told our government to tell people don't do autopsies on COVID patients. You cannot find that for which you do not look. I have a post-vaccine.
So,
wow.
Yeah, and I uploaded a separate video that I had beeped. I don't know why that's not there. I made specifically, I even added beeps and everything today on it, but
that was the one. Remember I told you at the last minute I grabbed one and because it was all squashed and weird looking. So it must not have carried through the beep.
Okay. What?
Well, he didn't say.
No, I cut him off.
Yeah.
So I beeped out. So anyway, but I wish I had that video now. Do you have it that you can play it even though it's squished? We can fix it later in post.
Give me a second.
Because I specifically spent like a half an hour adding in beeps because to take out key moments of this. But this is a key moment here. So Dr. Cole, I'll give you kind of a little rundown here. He's explaining the people that he's now seeing in his practice. He's a coroner. So these are people who are not talking anymore, who he's talking to or he's dealing with. These people all had something in common. And he's saying we were told not to be able to talk about this and not even perform.
Does he have any proof of that? Does he talk about
proof of what? The autopsies?
No, how Fauci sent this mandate to not.
I'm sure he does. Yeah, I haven't asked him specifically. I've invited him on the show.
Okay.
But I'd love to know specifically how these coroners, because I've heard this now from multiple different sources on coroners who have not been performing. We have other sources here we're going to show you in just a second. But so we have the squished version of this now.
And I was just going to say real quick, I don't think like a guy like that, you have to understand, like if you're speaking to power that can destroy your reputation, you better have your ducks in a row. And I'm sure he knew that. And so he wouldn't be saying that, I don't think, otherwise, unless he had proof, in my opinion.
Yeah. Okay. I just that's a big claim, and it's an important part of this, and I would like to see.
Yeah. So here is Dr. Ryan Cole again saying this, and by the way, we've also heard the same in Canada. We've also heard the same in Canada from medical professionals in Canada who have been saying that they've been asked not to. So this carries over. This is not just Fauci. Or it's bigger than that. But listen to Dr. Cole beeped out this time with a little squished video here. We apologize.
So what's happened to the autopsy, Ryan?
Well, Anthony Fauci told our government to tell people don't do autopsies on COVID patients. You cannot find that for which you do not look. I have a post 9-year-old on my desk, dead. I don't want to see one more child post ever on my desk. Are the autopsies starting to happen? You bet they are, finally, because people are saying, well, why wouldn't we do them? And in that same town from which this 9-year-old died, a healthy 22-year-old wrestler, after his third is now also coming to be on my desk so I can determine the cause of death there. We're told don't do autopsies, don't look, and that's what your government is giving you for data. Don't ask, don't tell, don't look.
And it's so interesting, the type of data that we are allowed to talk about and the type of data that the media picks up on, because I'm watching headlines all day. So these 2 studies that the CDC put out this week that showed some kind of statistical advantage of vaccination was very slight, and it was more like it was about statistics. It was not about trials. So the actual data they don't want, but if they can manipulate statistics, they want it. In order to feed into a pre-existing narrative.
Just like the New York Times piece from a few weeks ago that came out that it was it's been debunked now. They literally read the study wrong and wrote an article in reverse. It's been debunked now by multiple doctors. Like, no, you literally read the study wrong. What the study is telling you is the exact opposite of what the story you wrote. And then that went out to millions of people.
That happens more than you think, because I spend my time watching headlines, clicking through to the source and saying, that's not at all what this says.
So good luck getting autopsies. County coroners have been refusing to carry out autopsies on these sudden deaths among children. If you're a parent whose 7-year-old just dropped dead, and the only thing out of the ordinary is that they went and got something done recently, you'd want to know what's going on. Like in Vegas, this family, child's unexplained death and the refusal for an autopsy. This father who, his 7-year-old daughter, Brianna, suddenly died in Las Vegas, and the county coroner refused to do an autopsy. Listen to this father, heartbreaking, standing on her grave.
And she just was an amazing little girl. She was full of life. She smiled all the time. I dropped her off to school on February 16th, I believe. She had a stomach ache, and 2 days later she passed away in the hospital. Clark County Coroner's Office, they refused to do an autopsy on her, so we don't know what's going on. It's been 2 years. I don't see how they wouldn't have wanted to know what happened to a 7-year-old little girl.
It's heartbreaking.
Yeah.
Heartbreaking. We don't want to know. So,
all right. Well, another study out of the Cleveland Clinic shows that some interesting data about your risk of contracting COVID. It does not tell us much about hospitalization or death or even severe COVID. The reason for that is because in this study of 51,000 people, no one had severe COVID, even the people who contracted it. So this study, again, it's a statistical analysis of actual people who had COVID or who had the vaccine. It's not a human trial, but it's an interesting one. It says, and I'm quoting from the Cleveland Clinic, that doesn't come out so easily. The higher the number of vaccines previously received, the higher the risk of contracting COVID-19. Further, the study found that the current bivalent vaccines were about 30% effective overall in protecting against infection of COVID when the Omicron BA4, BA5 lineages were the predominant circulating strains. Now take a look at their chart. So what you see here, I'm going to explain these lines, is that people who had no dose are black, the black line. The people who had 1 dose, this is the red line here. People who had 2 is the green. People who had 3 is blue. And then more than 3 doses is orange. Well, that's in order, you guys. If you look at, and this is a timeline, days since the study started. And then the axis on the left is who got COVID. Well, you can see that it's the orange line that is more likely to actually contract COVID than the people who have had no vaccinations at all, which is not what researchers expected to find. The researchers concede that this is not at all the only one to indicate that risk of infection may actually go up with more vaccinations. Now, we've had doctors warn us, you can just deplete your immune system if you keep going with this vaccine. But now we have the data to prove it. This has also been observed. I don't want to use the word prove, but we have observed this now. This has also been observed in studies in Germany, Israel, and the UK. Now, one explanation that the authors say is that maybe those who received more doses were more likely to be individuals at higher risk for COVID. So that's possible, but a small portion of individuals may have fit this description, they said, but when they actually dug into the data, they saw the majority of subjects in this study were generally young individuals. All were eligible to have received at least 3 doses of the vaccine by the study start date. Now, again, they could not infer anything about the vaccine preventing severe COVID because in this study of 51,000 people, there were too few severe illnesses for the study to be able to determine if the vaccine decreased severity of illness, which contradicts what we are being told, that you should get this vaccine to prevent severe COVID or hospitalization. But if those cases are so rare, how do we know this? The authors are saying we clearly need more studies about this because it does seem to show what we've been warned about, increasing numbers of vaccinations. Again, it seems to be crickets about this on the mainstream media, though.
Yeah, and the latest data on excess deaths, if you want to take my laptop screen here. So these are the latest data points for countries around the world. So New Zealand, Norway, Poland are here at the top. You can see all the different countries on the list here that provide these data points. And on the left-hand column is the week, right? The week of the year. So we're approaching, and by the way, we only have data up until the 40th week. So we're still waiting on data from the last few weeks, but it's all trending upward from a number of these countries. I mean, all across the board. So you can see 12% increase here. And this is the column you want to look at, excess death percentage, which is a change from the average. So let's just take a look, go down the line here at Belgium. 12% increase, right? 23% increase here for Austria. 23% increase. Look at these last few weeks here of these particular months here through November, right? Denmark up from average, 17% increase excess deaths. Just go here, all the United States all the way here at the end, 13% increase. United Kingdom, 17% increase. The list goes on and on for these increases across the board for a lot of these countries. Slovenia, Portugal, 11% increase in Portugal from 10, 12, 16, 15, 2.5, and 11%. So, you can seek this data out yourself and you can look at these and wait for the, specific country data points for these excess deaths. But why are we not investigating this? Why is there not an international outcry? And only a few voices in the European Parliament and the United Kingdom in front of their parliament, and a few voices in the United States holding Senate hearings. That's it. Nothing. No outrage, no discussion about it.
And any of them that do stand up in their parliament or in these other countries, they're marginalized. They're like, oh, listen to crazy old Claire, now I can't remember her, Daly, going on again about this crazy conspiracy stuff. And they're just like laughing at him and everything. So it's like, they do run the risk of damaging their careers, but these people don't care. And the thing is, if you go back and listen to them and lay it on the timeline and lay it on the actual data that people have been putting out there, they've been right the whole time. And that's very unfortunate.
Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at Redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to Redacted.inc. We'll see you next time.